Nurse TV, brought to you by HESTA and the Australian Nursing Federation.
Hi, my name's Anne. Welcome to the Spinal Unit, Royal Perth Hospital, Shenton Park campus. How are you?
I'm good.
Good. Yeah, how's the pain going? The spinal unit here at Shenton Park campus is a 35-bed unit, and we take all the spinal cord injured people of Western Australia, so from the far north and the south and the metropolitan area. Once people are stabilised in the emergency department or ICU, they come down to the spinal unit and we manage the acute care of the spinal cord injured patient and the rehabilitation of those people, and also we do readmissions of spinal cord injured people from the community for things like pressure areas or fractures or follow-ups.
When you're going to take hold of his neck, this is the action that you want, especially with the filly. If you had traction, you would be supporting the fracture. So one at a time, you're going to put one hand in, into the shoulder and down, and lay your arm along there, and you'll take that sandbag away. You need a wide base of support with your legs. You need your knees bent so that you can move and switch your weight from leg to leg using your big quad muscles. This is the action that we want. We want to be using our shoulders. We don't want to be using our back. We don't want to be twisting.
Mostly in the acute phase, it's immobilisation of the spine and 6 weeks bed rest or fusion of the spine and post-op management. If there's 6 weeks bed rest, it means 2 hourly turns, assistance with washing, eating, drinking, bladder management, bowel management, skin care. Pretty well general nursing care, really.
To have a drink, Bob? Yeah, I set you up a little bit. Yeah, say stop when it's enough. All right? Yeah.
Yep.
Wonderful. Can I introduce you to Bob? He's a patient over here over 1.5 years now, Bob. Is that right?
Yep.
Yeah, he's coming from Kalgoorlie, and he's on a ventilator. So he had a very high injury of his spine and his neck area, and since then he can't move his arms and his legs, nothing anymore. He's a quadriplegic, and he can't breathe by himself anymore. So he needs this machine to assist him, not only to assist him, to give him all the air that he needs. And yeah, Bob is here 2 days a week at the moment. We try to bring him home, to get him home. And the team here from the Royal Perth Hospital, from the Shenton Park, especially Anne and Claire, they try to get a little bit of money from the government to give these guys the possibility to go home again.
Once they get through the acute phase, it's all about rehabilitating them, teaching them how to dress themselves, feed themselves, look after their bladder and bowel, going to physiotherapy and occupational therapy, and going through a structured program teaching them how the spinal cord injury has affected their bodies and how to manage with that in the community. Hey, how did your weekend leave go?
Yeah, really good.
Yeah,
really
did you feel any pain in your pins over the weekend like last time?
Just, no, still just this back one, just a little bit.
That was the same as before,
yeah,
was it?
same as that one, yeah.
Right, we're just going for the test now, Steve.
Yeah.
Remember, no pain. Okay. That's 0. Right, that one's 0, mate.
That one's 0?
0.
Serious?
Yeah, I think that one was going to be the suspect one anyway. And that's 0?
Dodgy, yeah. Okay. That's not good.
No.
Okay, well, you know the score.
Yep.
All right?
Yeah.
I'll get back to you.
Okay.
Yeah, he was really. I
Yeah, and we have all different sorts of patients, from all different sorts of backgrounds, and we're all different sorts of nurses. So we're a mishmash of different sorts of people, and it's good. It's good.
Morning, Shane. How are you? Sounds like you need a suction. You do? Okay, I'll sort that out for you. This is Shane Agnew. He's going to be 21 on the 20th of February. Is that right? Shane had a trail bike accident. What date was that, Shane? Of Feb. Oh, it's nearly your anniversary. On the 27th of February last year, he was unfortunate enough to sustain injury. He dislocated his neck from his occiput, which is actually the highest cervical injury that I've ever come across. That's not funny, Shane. Anyway, so what's happened to Shane is that he's unable to breathe for himself. He was actually lucky enough to have someone at the scene of the accident that was able to resuscitate him. He's unable to swallow food, so he's fed by a peg. He has a ventilator to help him breathe. He requires suctioning to get rid of his secretions. We're trialling a cough machine at the moment, which is doing really good for Shane's chest because he's been having a lot of chest infections since his injury, spent a lot of time in ICU. Shane requires all the usual things that spinal patients require: frequent turning, assistance with showers and dressing, hoisting in out of bed, all that, cleaning teeth and all that stuff because he can't use his hands at all. So that's about it, Shane, isn't it, really? Shane's hoping to go home. We've found some funding for him to be looked after in the community with 24-hour nursing care, and his folks are pretty happy about that. Everybody that comes in, it's horrible and tough. Doesn't like having a new patient come in isn't any easier. I've been here for over 20 years and it doesn't get any easier because it's a life tragedy.
Ketamine and all the other drugs.
I mean, I was here when John first had his injury, wasn't I, John? We go back how many years now?
17 years.
17 years. So when John first came in, he had little kids, 2 and how old were they when you were here?
2 and 5.
Yeah, and now they're grown men. One's actually doing tours in the Himalayas. And when they come in, it's just really amazing to think that I just watch them grow up. I'm great friends with John's wife. She's a magnificent person. And I suppose just it's like making a lifelong friendship in a way because John will always come back. So I've met a lot of really great people here through the patients and their families. It's just great to see people progress and his kids grow up, and we've always got something to talk about, John and I, haven't we, John?
Yes.
And not enough time to do it. I think the hardest part is dealing with this catastrophic event that a person's been through, and it's not only the patient that goes through this life-changing, terrible thing, it's the whole family that you have to deal with. And I think the psychological issues with managing somebody who's had a serious life-changing event is probably the hardest thing to deal with here. There's a lot of frustration and anger, grief, change of body image. So I think that's the hardest thing, really. People think that they might get up and walk again, so sort of trying to get them to progress through the rehabilitation phase when they think that there might be some miracle coming around the corner is really hard. The nursing itself is hard physical labour because you've got to move people in and out of bed when they can't help themselves, and also just doing everything for a person, trying to make sure that they have everything they need, food and water, and they don't get pressure areas, and that they're dressed. Helping them make decisions rather than taking over their life for them, that's really hard when they're so compromised and in such a situation. And educating them about how to manage their care when they go home.